Hi, I'm Dr. Beth Molleson.
And I'm Dr. Alyssa Watson.
Thank you all for joining us in the Veterinary Breakroom today, where we have short conversations about relevant topics in veterinary medicine. And today's topic was inspired by a recent news story. And that story was about the idea of whether or not an in-person VCPR, veterinarian client-patient relationship, needs to be established in person or if it can be done remotely. And this is actually quite the hot topic right now. I'm sure any of you out there listening that have thought about telemedicine or are familiar with the telemedicine companies out there. Of course, we all went through some of this with COVID, where, maybe we were seeing patients remotely more so than we were previously. So, of course, telemedicine in all of its forms has taken off in recent years. But what happened in the last few months is that California, which obviously is a huge state, so tends to be influential, they have passed a bill allowing the formation of the VCPR through remote methods. And so their governor, Gavin Newsom, I believe has not signed it yet. So that's what it would require for it to become law. So if my information is up to speed, I believe it's still one step away from being official. And then obviously that would be a huge shift for how things are done there in California. And California is not the only state that has or may have in the future have the remote establishment of BCPR, but there are 5 other states, so Arizona, Idaho, New Jersey, Vermont, and Virginia. And they're all slightly different. So for example, like with California, the vet themselves would have to be in California. I think in New Jersey, the vet can be anywhere in the country. And of course, there's several other nuances to each of these state laws, but that's kind of the gist of it. So, Alyssa, is this something you had heard of being debated around town or something you're familiar with? I know neither of us live in a state with this remote BCPR, but what have your thoughts been so far?
Well, it's definitely something that I think is being talked about nationally. Like you said, especially after COVID, a lot of these requirements for an in-person exam for a VCPR were kind of waived during COVID, but all of those that I'm aware of, have now expired. And so the vast majority of states, like you said, have gone back to needing that in-person hands-on examination in order to establish a VCPR. Now, then after that, whether or not you're having remote visits for things, again, that depends on your state. So you really need to keep up to date with your state practice act. I was surprised by the number of states that had already, done away with the in-person exam. So I was surprised with the 5 states. And like you said, they are different. Vermont, I think, you had mentioned New Jersey, but I think Vermont is the same way too, where they can, anybody in the whole country can establish a VCPR with a patient that is in Vermont and then potentially prescribe medications and do things like that. And so I thought that was interesting. I definitely think that there should be some guardrails on there in order to have limitations on who can be treating these patients, especially where you're licensed, given the fact that licensing is individual throughout the United States, then it doesn't make a lot of sense to me that this would be a way around that and, to be able to practice in another state. So I'll tell you the whole idea for me, I feel like a little bit like a split personality depending on which job I'm doing, since I do have a couple of different jobs. Yeah, since I do have a couple of different jobs. So the in-home hospice and euthanasia veterinarian in me thinks that this could be really, really helpful, really useful. I would love to be able to, get on a video chat, see an animal, talk with the owner, and be able to, potentially prescribe some pre-visit medications, anxiety medications for pain before I come over, in order to help that
Sure.
patient pass. And I think that it has a huge usefulness, if I have an aggressive animal. Currently we can't do that. So that means I need to make a home visit, meet the animal, meet the family in the home, and then I can prescribe, and if the ultimate goal is, or the ultimate outcome is going to be euthanasia, that's just another step. And that incurs cost and potentially a barrier to, that animal having a peaceful passing. So that's the one side, of me that is like,
Sure.
yeah, you should absolutely be able to do this. It would benefit so much. However, the flip side, the in-clinic general practitioner, which I still do as well, I have severe reservations because in my 20 years, I cannot tell you how many times I have diagnosed something from a physical exam that there is no way that I would have diagnosed if that animal, was not in front of me and I was not able to feel it and listen to
Mm-hmm.
it and look in its ears. I, even very recently, I had a dog come in for a Bordetella vaccine, and I diagnosed the dog with lymphoma because it had, a its peripheral lymph nodes were all enlarged, and the owner had no idea. The dog was not showing any clinical signs yet. It was not lethargic. It was nothing. It just came in for a Bordetella vaccine. And so, there's that type of interaction is what gives me such pause.
Mm-hmm.
So what are your personal feelings on it?
Yeah, no, I think I'm similar to you, or I have kind of those split feelings about it. I think the pros are, in some ways, I think it is in touch with reality in the sense that I definitely think there are many, many shortcomings to it, which I can get into. But I think the fact that it can be so hard to get veterinary care right now, the fact that there are certainly people in rural areas, the fact that there are so many exceptions to the rule where there's, elderly pet owners who can't get their large dog to the vet. There are, behavioral appointments where maybe a physical exam really truly wouldn't change what you're doing. And so, in some ways, I do think expanding the access to veterinary care in general is a good thing. But then on the flip side, I think, like you touched on, Alyssa, we all know that the physical exam for a patient that can't talk, I mean, just the physical exam is critical. You're going to find things that you wouldn't find otherwise. The in-person conversation with the pet owner. So, like at my practice where we have wellness plans, being able to have that patient there, maybe they're there for diarrhea, but we can sit down and talk. We can show them our brochure about how important all of these other services for preventive care would be and get them signed up on a wellness plan. Like all of that sort of stuff would be lost. And I think the really scary part is that pet owners don't know the difference. They think, oh yeah, the online seems more convenient than going in. I think there will be that educational gap for our pet owners, and therefore I do think there will be pets that get lower levels of care because of laws like this. Whereas again, on the flip side, maybe you do have some pets that are getting some level of care where they wouldn't have otherwise. But I think it's hard because I think it will impact different pets, different patients, and different pet owners differently. And I do think it's worth noting. I didn't mention this talking about the California bill, but the AVMA is opposed to this bill. The California VMA was opposed and then later changed their position to neutral. I may be mistaken, but I think some of that had to do with adding some guardrails. So I did just want to mention some of the nuance in this may change people's opinions one way or the other. So for California, at least, it would prohibit a VCPR from being established just by audio communication. So it would have to be, visual. It would, again, we talked about the vet has to be in California as well. It prohibits prescribing any medications for like horse racing, and then it prohibits controlled substances. And then I think there were some other states that prohibited like dispensing antibiotics for more than 14 days. And that's one of my other big concerns is, of course, antimicrobial resistance is so huge right now. The way I see, and I'm no expert, but the way I see many telehealth visits playing out is you kind of feel like the vet feels obligated to prescribe something at the end. The owner's expecting some sort of prescription for
Mhm.
their time and money. And then we have overuse of course, not just antimicrobials, other drugs too. But in the face of resistance, that's a very scary side of it to me as well. One other potential benefit I should mention too is a lot of like shelter environments are fans of this because I think they have difficulty getting access to care for all of their
Mhm.
pets. So yeah, it is really so nuanced and there are so many sides of it, but it is definitely worth mentioning that the AVMA tends to be opposed to these laws, which I think to me means something.
Yeah. Um, I agree. I think as some of these provisions and guardrails have been added on, a lot of those, national organizations have softened their stance a little bit. It's interesting, I don't know, are they truly getting on board, or are they perhaps saying, okay, we know this is probably the future
Right.
because of the way that human medicine has happened. And I've said it on this show 100 times. Just because something is done or works well or doesn't work well on the human side does not necessarily mean that that is going to equate to veterinary medicine, because there are real significant differences. Just like you said, our patients, they can't tell us how they feel. There's no such thing as symptoms. We have clinical signs, and those are subtle distinctions, but they're very important when we're talking about these things. And so I worry a little bit that some of these organizations are like, well, this is coming, we're going to have to, instead of throwing all of our weight behind stopping this train,
Right.
maybe what we need to be doing is laying the track in the direction we need it to go.
Right.
And that's not necessarily a bad thing, because I do think that those provisions that you spoke about, especially in this California law, are really, really important. And
Mhm.
I think that there's even probably some other ones. I do like the idea that this cannot be established with audio only. It has to be some sort of video communication. I think they even said you can't establish care with a survey or like
Mhm.
an online. But I mean, those are things that I hadn't even thought of. But I'm sure
Right.
somebody has thought of that. Oh yeah, why can't I just go fill out this questionnaire on
Right.
Google and get, antibiotics. So,
Right. And I do think the what you mentioned about human medicine, I do think that is one of the big talking points that these proponents are using is kind of saying, "Hey, look, the human telehealth has really boomed since COVID started. Obviously, there's a ton of money in that has come from that, and I think that's one of the talking points that they're using to kind of push this through, especially when it comes to dealing with legislators who may not know the nuance of veterinary medicine. It kind of they try to say, hey, there's if it works in humans, there's no reason it won't work in vets. Like, let's just focus on that idea. And I think so many of us know, like you said, that's not, comparing apples and oranges. So it will be interesting to see how it plays out for better, for worse, many pros and cons. And uh, I did want to mention too that there was VIN had an informal poll of members, and they asked, should an in-person physical exam be required to establish a VCPR? And they had about 2,200 respondents. And so I just thought these were interesting to statistics, so all you listeners can figure out where your opinion lies compared to everyone else. It sounds like 54% said yes, face-to-face exams are necessary to establish a VCPR. 36% said yes, face-to-face exams are necessary to establish a VCPR with exceptions. 5% said a VCPR can be established remotely, done deal. 4% said that they were undecided. So certainly lots of different opinions there too. Obviously, the exceptions could be wide for those that said yes with exceptions. But I thought it was kind of interesting to see what everybody out there is thinking. So
very interesting indeed.
yes, we will keep our eye on the latest. I encourage everyone to keep an eye out for anything in your own state that might affect the telehealth laws. But Alyssa, I think that brings us to our win of the week. Do you have anything good to share with our audience this week?
So I have a little bit of sad news, but also good news. Anyone who watches the show knows that I have had a beautiful Dog de Bordeaux, Luna, who was just the love of my life. She was my heart dog. I loved her so much, and she passed away, and so I've been a little bit lonely. And I have recently been in contact with a Dog de Bordeaux rescue, and actually coming up in just a couple days, I'm going to meet a new dog and see if she might be a good fit for our family. So we'll see the next time we're all together if I have a new dog lying behind me and panting during the whole episode.
A new subtle sound of snoring. I miss Luna's snoring.
Yeah,
we used to
I miss Luna's
sometimes
snoring too.
Yes, get a little bit of microphone pickup of that snoring, and yeah, she was just the best. But keep us posted. That sounds like one lucky dog if it winds up in your household. So I'm excited to hear how that goes. But
how about you? What do you have to share?
Yeah, my one is, let's see, completely unrelated to veterinary medicine, but it's big news in my household, and that is my husband and I went out this weekend without our children. So that's, when you've got a 2 and 5-year-old, that's what the wins look like these days, is just escaping for a few hours. We had a really good friend get married. The wedding was lovely. There was lots of refreshments, we'll just say. And the next day, the funny part is the next day I actually scheduled family pictures for us. And so my husband was not in a great mood, realizing that he had to rouse himself for family photos the next day. But anyway, it was delightful. I still feel like every group gathering post, COVID pandemic world, I am that much more grateful for. So this weekend was one of those.
That's great. That's wonderful.
Anyway, Alyssa, well, to our audience, thanks for listening in today, and we will catch all of you on our next episode.
Take care, everybody.
Thank you for listening to today's episode of Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@vetmedics.com. Veterinary Breakroom is a VetMedics production produced by Alexis, Ussery, and co-hosted by Dr. Alyssa Watson and Dr. Beth Molleson.